medication safety. So everybody was taught in school about the 6 rights of medications. Right patient, right route, right drug, right dose, right time, right documentation, okay? So right patient is fairly easy for us. We only usually have one patient, okay? The right route is also fairly easy for us. We only have a handful of drugs that can only be given a certain way. For example, your Decadron has to be given PO, but you have to watch out for that one because it actually comes in the IV vial, okay? Your ODT Zofran has to be given PO, okay? You can't crush it up, you can't break it in half. You have to give them the whole thing to put under their tongue to let it to dissolve, okay? So those are the easy ones, all right? The right drug. Yes, we decide which drug we're going to give based off our protocols, but you have to actually physically go in and make sure you pick up the right drug, okay? I picked up this drug, it's the diltiazem. I can read it, I can read the concentration, and I can read how many milliliters are in this vial. So if I had to give this drug, I could give it because I know it's the right drug, okay? I'm going to pick up this other one. Somebody's dated this one because it was in a truck that wasn't plugged into a shoreline, but they covered up the label. So I can't even technically read what drug this is. So I can't give this drug, all right? We can go to one less extreme where it's a Sux. It's a succinylcholine sticker on a bottle that I recognize is probably succinylcholine, but the edge of this sticker has covered up the actual name on the manufacturer's label that says succinylcholine. So I can't, in good conscience, give this medication because I can't say without a doubt that this is succinylcholine based on facts. I can make assumptions that this is succinylcholine, okay? This Sux I can give because I can read the name, I can read how much is in the vial, how many milliliters are in the vial, and even I can actually read the concentration without having to do the calculation on my own. So I have to be able to read the vials in order to make sure I have the right drug. I also have to be able to read the vials to make sure I can calculate the right dose. Because not every medication is as simple as Zofran, where you're giving them 4 Zofran, you just pull the whole thing up because that's 4 milligrams in a vial. You pull it up and you give it to them, okay? It's not that simple for everything. And what if the concentration that we order Zofran in changes later? Like our Valium that we're fixing to put back on the truck, okay? Valium used to come in 5 to 1, 5 milligrams in 1 milliliter. Now it's 10 milligrams in 2. So you have to be able to read the labels to adequately calculate the correct dose to give your patient, okay? Time for us is a little different because we don't usually get medications where you have to give it at 1700 or you have to give this at 0700 and stuff like that. And we all know this, but for us it could mean, that you have to wait the appropriate amount of time before you give the second dose, okay, or the third dose. Or it could mean you have to give a medication a certain number of times before you can move to the next medication. For example, your pain management protocol, you have to give a pain medication 2 times before you can move on to ketamine, okay? So you have to give a dose of fentanyl, wait 15 minutes, give another dose of fentanyl, and then after that point, you can then give ketamine if they still need it and you have time, okay? So that's a few ways that we could associate the right time for us. Another way is for those transfers that are a little bit longer than standard, okay? So you're taking somebody, 2 or 3 hours away and they're on Coumadin, okay? And they have to take it every night at 5 o'clock because it's one of those medications they really like them to take it at exactly the same time every day. But you're discharging them from the hospital to go up to a nursing home, 2 and 3 hours away, and you're going to be on the road at 5 o'clock. So they say you need to make sure she takes her Coumadin at 1700 hours. They give you a doctor's order for everything to make sure, and they even give you a dose to give her en route, okay? So that's one of the few times, or a few examples, you would have to give a medication at the exact time, okay? So you have to document all of that too, okay? So the right documentation, if you give all this stuff correctly, but you document it wrong, it's going to appear that you gave the wrong stuff, okay? So make sure you document the right patient, the right drug, the right dose, the time you gave it, okay? The other side of the documentation is pay attention to how things are documented in your flow chart. So the succinylcholine, for example, when you click on it, you're going to give, say you gave a patient 80 milligrams of Sux, okay? And they were a little bitty patient, so you gave them 80 milligrams. And you go to document it, but when you click on it, it comes up in milligrams per kilogram. So there's another option, you just got to click on it, and a drop-down box comes, you select milligrams, so you can just document 80 milligrams instead of doing 1.5 milligrams per kilogram, because yes, that's what's in the protocol, but we'd like to know exactly how much you gave this particular patient with just by looking at the flow chart, not having to go calculate it on your own, okay? So those are your 6 rights, okay? I'm going to show you Valium that we're getting in, that we have in. We just haven't issued it to the truck, so you can be familiar with what it looks like and the concentration for it. And then we're going to do a few calculations. Okay, so now we're going to do some simple med calculations using these 4 drugs with some weights that I just randomly picked, okay? So we're going to do diltiazem first, okay? We're going to go with a 75 kilogram patient, okay? So your first dose of diltiazem is 0.25 milligrams per kilogram, okay? So you'll simply just do the 0.25, okay? You're going to multiply it by the 75, okay? Really, 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 really simple. So you're going to get 18.75. Okay? So one of the things I like to do before I just round down to this one to do 18 milligrams is to divide it by the concentration of the diltiazem to see how much of a hassle it is to draw up that dose. Okay? So if you look at your diltiazem, the one where we can see the label, it gives us a concentration of 25 milligrams in 5 milliliters. Okay, so that's a smallest concentration of 5 milligrams in 1 milliliter. So let's take this 18.75, okay, and divide it by 5. That actually gives us 3.75. Okay, so that's how many milliliters you're going to draw up for this dose. Okay, so that's the max dose you can give them on your first attempt, and it's a relatively simple dose to draw up. So let's go ahead and give this dose. So we're going to give the dose to that. We're going to wait your 15 minutes according to your protocols, and it hasn't helped. So we're going to go ahead and we're going to give the second dose. So the second dose is 0.35 milligrams per kilogram. So we're going to multiply this by 75, and that's going to give us 26.25. Okay, so in your protocol, your diltiazem has max doses. So for your first dose, your max dose you're allowed to give is 20 milligrams. For your second dose, your max dose you're allowed to give is 25 milligrams. Okay, so this is bigger than 25, so all we gotta do is we're just gonna give the 25 milligram max dose. And since our diltiazem comes in 25 milligrams in 5 milliliters, you just drop all 5 milliliters and you give them that dose of diltiazem. Okay, it's not hard math. I do all of my med calculations using a calculator, unless it's like by tens, stuff like that. But I try to do as many calculations as possible using a calculator because it creates an environment where there's a less possibility of calculation errors due to me being a person and not a calculator, okay? So we're going to go on to the succinylcholine. Okay, for the succinylcholine, we're going to use a 87 kilogram patient. All right, so your succinylcholine, the dose is, let me write the 87 kilograms up here. Okay, the dose is 1.5 milligrams per kilogram. Okay, so we'll take that 1.5 milligrams and we're going to multiply it by 87. Okay, and so that will equal 130.5. Okay, 130.5. So we're going to take that and we're going to divide it by the concentration of the sux. So if you look at the sux vial, it has a concentration of 20 milligrams in 1 milliliter. So we're going to take that 130.5 and we're going to divide that by 20. Okay, that equals, where'd it go? 6.525. All right, so we're going to go ahead, we're just going to round down. We're going to give 6.5 milliliters. Okay, so that's how many milliliters you're going to give of your sux that comes in a concentration of 20 milligrams per milliliter. That'll give you your 130.5. Okay, so now we're going to go to our dexamethasone, which is for pediatric patients. Okay, your dexamethasone is in your pediatric asthma protocol. So it is, the dose for it is 0.6 milligrams per kilogram. So we're going to go with a 12 kilogram patient. Okay, 12 kilogram patient. All right, we're going to give them the dose of dexamethasone. So we're going to do 0.6 times 12. Okay. That equals 7.2, again, because I already did the math. All right. I used a calculator. Especially with pediatric patients, it's always very important to make sure your pediatric patients have the correct dose calculations. Okay. So 7.2. So you never want to round up your doses with pediatric patients. You can get away with it in adults, but don't round your doses up with pediatric patients. Always round down. So we're going to do it 7 milligrams. Okay, your dexamethasone comes in with a concentration of 10 milligrams in 1 milliliter. Okay, so we're going to divide that by 10. Okay, and that is relatively simple math. It's 0.7 milliliters. So you're going to use a 1 milliliter syringe, and you're going to draw up, out of the dexamethasone, you're going to draw it up to a 0.7. They're clearly labeled on there. It makes it really simple. Okay, so that's your dexamethasone. So now we're going to do ketamine, and we're going to do it for the pain management protocol for the IV. Okay, we're going to give the IV dose of ketamine for pain management after you've already given 2 doses of fentanyl or 2 doses of morphine, and they still need more pain management. Okay, so your ketamine has a range. 0.25 milligrams per kilogram to 0.5 milligrams per kilogram. Okay, so what we're going to do is we're going to calculate both ends of this spectrum based off of a 97 kilogram patient. I put 97 pounds on there. We're going to do 97 kilograms. Okay, so the first one we're going to do 0.25 times 97 equals 24.25. Okay, so 0.25 milligrams times 97 kilograms equals 24.25 milligrams. All right, so now we're going to do the 0.5 times 97, and that equals 48.5 milligrams. So let's look at this a different way. So your range, instead of doing the 0.25 milligrams per kilogram to 0.5 milligrams per kilogram, it's actually 24.25 milligrams to 48.5 0.5 milligrams. Okay, so at this point, we can take any dose of ketamine within this range and give it to our patient. Okay, so let's go ahead and we're going to do 30 milligrams. Okay, so our ketamine comes in a 500 per 10 milliliter vial. So you break that down, that's 50 milligrams in 1 milliliter. Okay, so you're going to divide your 30 by 50. Okay, you can break it down further, doing 3 divided by 5, it doesn't matter. It's going to equal up to 0.6 milliliters. Okay, so you would use your 1 cc syringe again because they're labeled in tenths. Okay, you would pull up 0.6 milliliters out of the ketamine vial and you would have your dose of 30 milligrams. You give that to your patient for pain management purposes. Okay, so these are just a few simple med calculations. If you have any problems with med calculations or you want to practice some harder med calculations, because I'm not doing drip calculations in this one, just give me a call, shoot me an email. We can work on them, we can practice them, you can come up here and see me, we can do it by email, however you want to do it. So if you need any help, just let me know. But the biggest thing we wanted to focus on this one was your medication safety. So make sure you get them to the right patient, right route, right drug, right dose, right time, and right documentation. And then make sure you label, when you put dates on your drugs, you don't cover up the information you need to be able to get to the right dose and to make sure you have the right drug. Okay, so again, if you have any questions, just shoot me an email, give me a call. Thanks, guys.